I told myself that I need to have a heart screening. So I have an angio CT scan in Indonesia, and it turns out my classification is very high. I also have a symptom which is fatigue, easy to get tired. And when I do the exercise, when my heartbeat reach 140 beats per second, shortness of breath is experienced. So I didn't realize at the time. I thought it was very common for people that don't exercise a lot, having this kind of experience. But it turns out that I have some issue with my heart. And then it turns out that I have to have a MIDCAB surgery with Professor Kofidis. Of course, there's an open heart bypass, but MIDCAB bypass is safer. It's a shorter procedure, faster recuperation, healing.
First of all, Joe was a very suitable candidate for minimally invasive heart surgery. An otherwise slim, not very obese man without too many other diseases presents a very comfortable, low risk for any bypass surgery. That is what makes him a good candidate to include him into our fast-track system. In order to be able to deliver a fast-track application on a given patient, of course, you have to apply a minimally invasive technique. You cannot cause too much trauma to the patient, which is defined by the traditional median stenotomy. So number one, minimally invasive access, not breaking bones, not losing too much blood in the operation theater, not requiring any blood transfusions, for example, keeping the heart beating during the procedure. Mr. Joe's surgery was not only minimally invasive, it was performed on the beating heart without stopping the heart. Another criterion is keeping the temperature of the body stable. Anesthesia plays a very important role. We keep the anesthesia, the narcosis timed, well timed, and that all taken together, along with intense physiotherapy, encouragement, and work as a team in the ICU as well as in the general ward, facilitates a totally new patient experience. Much faster extubation, waking up extubation, then obviously mobilization, that ultimately leads to a very short hospital stay. Now the fast track continues after the discharge. What happens to the patient when he leaves the hospital? Of course, he is fully mobile and independent, but we continue our physiotherapy targeted for heart patients. That results to a refunctionalization of the patient.
It was very fast, faster than I thought. It took only 1 hour 45 minutes. The next morning, I already woke up and I feel like a new man, I must say. So yeah, after the discharge, of course, the first night is I went for dinner with my children, with my family, and then next day, wake up, feel fresh, feel good, and start walking already to see my physiotherapist, do the ECG and everything, and it turns out everything is normal.